Hello there, and thank you for checking out this short video. My name is Dr. Susie Harris, and I'm the owner of Cedarwood Natural Health Center. I'm going to teach you a little bit today about regulation thermometry. It is a screening that we do here at Cedarwood that is extremely useful in getting to the root cause for some of the tough health issues that some people are experiencing. They've tried a lot of things, even inside of here, working with us. If we hit a bit of a plateau, we like to do this scan to try to see if there's something we can pick up on that would give us another layer of working with a person to get them moving forward on what they're trying to clear. So regulation thermometry, what is it? It is a scan. We use this infrared thermometer. It's a very sensitive infrared thermometer that we're using to touch on different points on the body. We're registering temperatures of organs, glands, your sinuses, your teeth, breast tissue. For men, it's also prostate, all the organs, right? Liver, gallbladder, colon. So we go through and we measure temperatures of these different organs and glands. Once we get a baseline on those temperatures, we have you go into what's called a cooling stimulus. So we have your shirt and your pants off. You can keep underwear on. And for about 10 minutes, you're cooling. And that is going to cause your body to have a nervous system reaction that is supposed to balance things. Like when you incur a stimulus of cooling, if health is up where it should be, your body will adjust and temperature changes will occur that keep you regulating and operating properly. So Angie, who's been doing these scans for us, comes in about 10 minutes after you've cooled down and remeasures with this infrared thermometer all the same points. And so let me just give you a picture real quick of these points. Oh, I'll show you another way. So actually, I'll show you the report in a second. So we measure these points all over the body and you cool for 10 minutes. Angie comes in and remeasures those points, and there's a very expected temp change. How far of a temp change? Did it go up? Did it go down? Those things matter. If the body didn't give an appropriate temperature adjustment after the cooling, it gives us information about the function of that organ or gland. And it can really help us hone in on some hidden things that might be keeping a person stuck. And it also, even if you're feeling great, it's a really awesome prevention tool to catch things early and be able to kind of clear issues that I'm going to show you in this report that can keep you out of trouble with things like insulin resistance and pre-diabetes, chronic gut issues, hormonal imbalances, dental issues that might be affecting your breast tissue health and that sort of thing. Let me just show you this quick report here. This is one of our patients who did this. I have her name blocked, so we won't know who this is. But if you look, this is the pre-cooling temperature readings that we took. When we see this red stuff here, what we know is this person is experiencing inflammation in the lung area, also probably some cardiac stuff. And coming down here, this is like liver, gallbladder. I'm sorry, actually, I'm looking at this backwards. This would be more like spleen and colon. So even before we did any of the testing, this person is dealing with some inflammation that would be good to get rid of. So post-cooling, if we come over to this test, we see some yellow coloration in the neck here, which is generally indicative of hidden infections in the mouth and teeth that could be causing irritation and congestion and lymph in the neck. And when you come down here, these are darkened areas. These are typically metal toxicities hung up. I would say this is in the thyroid area, and this is starting to affect heart or potentially breast area, breast tissue. And this is part of the pancreas. So that could be indicative of some beginning insulin resistance and things like that. So I realize I'm going through this rather quickly, but pre-cooling, we see inflammation on this person. Post-cooling, we're seeing hidden infection and metal toxicities and potentially some lymph blockage in the tonsillar area. So if we go on to the breast exam here, again, this is pre-cooling, a lot of inflammation in the axillary or armpit area, which could be some lymph congestion. That's not what we want if we're going to be trying to keep breast tissue healthy. And then here we're seeing again that darkened area where there could be some trapped metals or chemicals creating issues there in the breast tissue. If we look at this piece, I'm going to see if I can bring this into the camera a little closer. These are mild concerns around breast tissue, and this is more of a severe concern. Okay, so when we see issues like that popping up, it doesn't necessarily mean a person has cancer, but we are seeing preconditions that are setting this person up for some poor lymph drainage through the breast tissue. And I'll show you in a moment how we get into, well, what would we do about that? And exactly what are we thinking that is? How do we target that and get that to change? Before I go to that, I'm going to show you this. This is the dental. Okay, so in this person, where we're seeing the gray polka dotted teeth is something to do with gum health. There's some poor gum health going on there. Where we see the blackened areas, that's more dealing with a person's toxins. They might have toxins or infections hanging out in those teeth. So we would go through with our muscle testing with a little bit more advanced techniques to be looking at the teeth, making sure we're picking up on hidden infections or toxins hanging out in that area. We'd also be doing some advanced techniques around the areas that showed inflammation and maybe toxicity building up in the tissues. You and I can be doing muscle testing like we do, and everything seems okay. Sometimes we run these scans and we see an area that's in stress, and we can go do a little deeper dive on those areas. Last thing I want to show you. So I'm folding this up so I can keep this person's information private. I don't know if this is going to be legible to you guys, but essentially what we have is the top 6 priorities that came out of this scan for this person. So I go through and kind of pull out the details of this. For this person, essentially, dental toxicity was very high on the list. And there is a stat that shows many women that have been diagnosed with breast cancer have issues with the second molar. There's a somewhat of an acupunctural meridian relationship between the second molars and the breast tissues. So paying attention to teeth and teeth health can definitely make sure you're getting good health and lymph movement through the tonsils and neck, which will then let you keep lymph movement through breast tissue and armpits. We want that lymph moving. It takes toxins out of those tissues and brings nutrients. The blood supply brings nutrients in. So that's a way to really kind of keep an eye on how well are we maintaining the health of breast tissue. The second thing on this person was heavy metals. And the third thing was gut microbiome imbalance. The fourth thing was a global immune stress, which kind of points to maybe potential for autoimmune. Usually that gets our specialty kits out again. We're looking for things like retroviruses, Epstein-Barr, shingles, cold sore viruses, looking to see if those hidden viruses are creating a low-key chronic inflammation that won't resolve. You know, those kind of hidden issues are what can keep an immune system active. And medical community would say that's an autoimmune disease. The docs I study under would say, well, there's a hidden something that's getting that immune system active. And if we go clear that hidden something, the immune system calms down. We no longer have the autoimmune disease. So there are other pathways to dealing with that issue than just going on immunosuppressant drugs and things like that. And then this person showed sinus blockages and that sort of thing. So I know that's a lot of detail, but I wanted to give you a feel for it. It's a really great tool for prevention and for optimizing your plan when you are engaged in trying to clear a health issue. If we can lock on to some hidden things and then specialize our approach, we can get a little more traction. And we like to run another one of these, maybe 3 months, 6 months, sometimes a year, depends on what came out on your first scan, to just see, okay, we ran the scan, we saw some stuff, we brought that into the muscle testing and got a little more specialized with what we were doing. created a new plan or added on to what we were doing, employ that for a little while, and then rerun that thermometry scan and see, are we making headway on clearing these issues that can be root cause problems for your ability to keep yourself healthy? Okay, I hope that makes sense. Click on the link below and you can go to our website and read a little bit more about thermometry. If you're interested in doing a scan, you can also give us a call, 802-863-5828, and we can walk you through what it's like to schedule an appointment for that. Okay, I hope you're having a great day, and thanks again for checking this out. Take care of yourself. Bye-bye.